Hi, my name is Ubaldo Reyes. Welcome to my channel Radiofísica con Baldo. This video is the first part where we show how a treatment plan for prostate cancer in tomotherapy has been developed.
In this video, I want to demonstrate how we elaborate a treatment plan in tomotherapy for a prostate cancer. We once again had to divide this video into two separate parts. In the first video, we'll see the counter involved and its regions of interest, and the characteristics for the treatment plan. On the second video, we'll talk about the optimization and fractionation for the treatment plan. We'll analyze three phases, and then our final comments in regards to this topic. Before beginning with the counter involved, we are going to define key factors in regards to this video. In our case, we have a man diagnosed with prostate cancer, and he is 75 years old. The radiotherapist has prescribed three phases. The first phase are 45 grays in 25 sessions for the whole pelvis. The second phase are 9 grays in 5 sessions for the vesicle seminal. And the third phase are 27 grays in 15 sessions for only the prostate. Once this is clearly clarified, now we head to the planning station and begin the process. First, we download our patient with all its structures. Check them and reduce points. Now, I'm going to turn off all of the structures, and I'll see only the 3 PTVs. We're going to work with PTV 45, PTV 54, and PTV 81. As you can see, the PTV with 45 grays is the longest in volume, rather than PTV with 54 grays. The PTV with 81 grays is the smallest in volume because it's basically the prostate. Now we begin with the countering for our auxiliary structures. The first one will be called A1. It's a structure that will have the following characteristics. It will be 2 centimeters outside of the PTV 45. Once we are done countering, now we reduce points and check that it's complete. Moreover, we will begin with the first ring. We will call it ring PTV 45, and it will have the following characteristics. It will be attached with auxiliary A1 and separated 0.4 centimeters from PTV 45. We counter it in all of the slices, and once it's ready, we simply check that it's actually complete. If it's complete, we initiate with our other optimization structure, which will be a cooler, and will be called ENF PTV 45. Basically, the structure will be countered where the PTV has drastic changes. For example, this area. We begin to counter here. This is where you can see the difference, where we have a series of peaks on the PTV. That's where we'll place our optimization structure. It is placed to help us control the dose in that area. We apply everything that is done with the structures. First we save, and then we reduce points, and we check that it is in place where we want it to be. If everything is perfect, we then modify the auxiliary A1, and for that we'll select and delete everything we already have countered in this structure, because we will do the following. Now it will be 2 centimeters outside of the PTV54 and follow the same process. We counter it in every slice where the PTV54 is located. Once we are finished with all of the slices, we save and reduce points and verify it's complete. Right after that, we begin with our new structure, which will be the ring PTV54. That structure will be 0.4 centimeters out of the PTV54, and it will be attached with auxiliary A1. We initiate the countering process with each and every slice. Evidently, each structure becomes shorter and it makes it easier to counter. Once that's done, we save and reduce points and make a verification. We will modify A1 again, delete everything we have countered, and now we place the structure 2 centimeters away from PTV81. Once again, the process is faster because the third volume is shorter and it makes it much easier to counter the structures. Once it's set, we simply accept and reduce points and add the last ring, which will be ring PTV81. The characteristics are that it will be 0.4 centimeters away from PTV81 and it will be attached with the auxiliary A1. We counter it in all of the slices, make a visual inspection, accept, and reduce points. If everything is fine till this point, we delete our structure A1, which was our auxiliary, but since we will no longer use it, we will delete it from our system. We just select and delete it. Last but not least, what I do is set the color gray to all of the structures that will help me contain the dose. In this case, the 3 rings and the cooler are all of the same color to distinguish them from other organs at risk. Now we visualize all organs at risk and make a final visual verification of all of our structures. And with this, we finish the process of countering auxiliary structures. Regions of interest and plan setting. We head to the RIOs tab, and the first thing we do is define which are our target volumes. In this case, there are going to be PTV45, PTV54, and PTV81. I place the following priorities like this. The smallest volume will be my main priority, PTV81, so it's well covered. Then the PTV54, one which is the next one, and the third one will be PTV45, which is the biggest one. For the RIOs, I usually, as my number 1 priority, place rectum, bladder, intestinal bag without PTV, right and left femur, the ring 45, ENF 45, penis bulb, and finally the external. We now head to the plan setting tab, and the first thing we'll do is locate the red laser. For that, I'm going to make the external structure disappear so I can visualize where the 3 referential marks are located. And look around the slices, first on the transversal plane and then on the coronal plane. Once my references are identified, what I do is set the red laser, first on the transversal plane and prior to that on the coronal plane. I usually help myself with the zooming tool. Ready. The red laser is correctly located and fixed. For this plane, we will do the following. Delivery mode, tomohelical. Plan mode, IMRT. Field width, 2.5 centimeters. Jaw mode, dynamic. Pitch 0.436. And finally, we locate calibration curve. And that's all we will do in this part of ROIs and plan settings.